All right, Nisha the PA, we are live.
Hey guys, it's Nisha the PA over here at Dr. Emer's office, and today we're doing one of my favorite combination treatments for addressing acne concerns. I'll tell you a little bit about my patient so I can walk you through the process that we're doing and why we're doing it. So his acne scarring, his main concern was acne scarring along his cheeks. It's not as noticeable now because he's been doing such a good job at doing his maintenance lasers, but you can still see a little bit of acne scarring up here to the apples of his cheeks. I'll show you the other side as well. And a little bit of scarring on this side. Now, this is so much better than when he initially got here, but you can still see a little bit of it. Now, what we're doing is a combination, which I love to do here, of Fractora, which was used as microneedling with radio frequency. So Fractora is great at addressing textural concerns. You'll see these are little needles that radio frequency will come out, and I'm going to push these needles into his skin, so it's going to really help to retexturize his skin, help to improve his acne scarring, which he has. In addition to doing the Fractora, which is microneedling with radio frequency, you can do this on all skin tones. This is perfect for his skin tone, perfect for my skin tone. I'm also going to combine that with our Clear and Brilliant Touch. You guys have heard me talk about this a bunch. I really love the Clear and Brilliant because I can use two different hand pieces at the exact same time. First hand piece I'm going to use on my gorgeous client is one that's going to additionally help textural concerns. The other one's going to help with more so pigmentation. So this one hurts a little bit, guys. So I've already done his forehead, and I'm going to go ahead and do the rest of his face. Now, I like to tell you guys when things are spicy, and this is Fractora. It's a little bit spicy, which means it hurts a little bit. It's more so uncomfortable on the forehead. Once you move down to really like the mid-face, it's a little bit more comfortable. But hey, we all know that sometimes it's a little bit uncomfortable to get you to where you need to be. We do our 30 minutes of numbing beforehand, which helps the procedure be a little bit more tolerable. And honestly, the number one question I get is how many treatments will I need to do? Now, that's a very important question. I really love when I'm asked that question because the answer is, number one, it's going to depend on how severe your acne scarring is. Number two, it's going to depend on really what you're able to do in the time frame. So when I'm talking about treating acne scarring, I recommend that you do a maintenance laser every 4 to 6 weeks, and you're going to have to do that consistently, sometimes for a year or two, before we can really get you where you want to be. Although you're going to see drastic improvements along the way, you still need that consistent treatment of your skin to really improve it. Now, as I mentioned, that's going to be a combination of using your lasers. It's also going to be skincare. All that's going to play an important factor.
Nisha, can we tell them about what skincare products we like to use after our Fractora and our Clear and Brilliant?
Now, there's a couple of great products I recommend when it comes to healing after you do your laser treatment. Number one, I'm going to recommend a product called Foaming Wash. Foaming Wash is something that we love to use after our lasers because it's strong enough to wipe away a lot of debris, but it's gentle enough to not strip your skin of any excessive oils, which is super important because when we're microneedling, we're creating these little holes into your skin. We don't want you to get too dried out. The second product I'm going to recommend is a product called Refit Face, an anti-age serum. So anti-age serum is your concentration of growth factors, and then your Refit Face is your concentration of peptides. Both of those will help you to heal quicker than if you didn't do any of those products. Now, the last but not least, we definitely want you to moisturize with a light moisturize. Here we recommend Sente Dermal Repair. And then afterwards, we want you to use your sunscreen, 30 SPF minimal, because that's going to be important when we're talking about hyperpigmentation. So this is a great quick procedure. As you can see, I'm almost done with the Fractora, the microneedling radio frequency. We only have a smaller part to do on the left side of his face. And then we're going to move on to the Clear and Brilliant. I'm going to turn all the way to the right. Perfect. All right. If you guys have any questions, please feel free to ask.
Guys, send us a DM with your full name, email, and phone number. We'd love to reach out to you. If you guys want to see a lot of questions get answered, you can check out our live that we posted from last night. The full live is on YouTube where we answer questions for an hour long with our treatment coordinator specialist, Jenna and Justin. So make sure you guys check that out. Lindsay tuned in and so did Dr. Emer.
So as I mentioned, guys, right now we're doing the Fractora, which is microneedling with radio frequency. We are just about done. You can hear the machine delivering the radio frequency energy. It's a little uncomfortable, but it's worth it.
And guys, our patient has done several treatments. We like to call this our lunchtime laser treatment. It's short enough that you can do it on your lunch break and go back to work right after. He's been doing several treatments. His results do look amazing.
Remember, this is minimal downtime. Sometimes you'll get a little bit of pinpoint bleeding, but look, there's literally nothing there. Not even pinpoint bleeding in his case. So you can literally go back to work after your treatment. The Clear and Brilliant for Fractora long downtime may be a day or so if you're using the correct products. Combine this with the Clear and Brilliant. Clear and Brilliant has no downtime at all. You're going to be a little bit red after the fact, but that redness goes away by the next day. Afterwards, you may have a little bit of a sandpaper texture feeling. That's it, guys.
Nisha, why do we use this over Morpheus?
Now remember, these two things do two different things. Fractora is more so for textural issues where Morpheus A can go a little bit deeper, so we use that more so for skin laxity. I'm going to have you look straight. Perfect. I'm going to have you tuck your upper lip for me. This is a little bit uncomfortable.
What are the tangible differences between the various types of microneedling and radio frequency?
Now, those are going to be completely different depending on the depths that they go. So if you are, say, for example, newer to treatments, and you kind of want to just get your feet wet, you can start out with just plain old microneedling. Nothing's wrong with that. If you wanted to kick it a step up, I consider Fractora to be microneedling on steroids because it's that radio frequency energy combined with microneedling that's really going to help with textural concerns. If you want more so skin laxity, then it's the same thing, microneedling radio frequency. The difference is when it comes to Morpheus 8, I'll show you the handpiece. We don't have a tip on this yet because each tip is for each patient. It's going to be able to go deeper, and you can use it on almost any part of your body that you want tightening.
Someone's asking, do we do Fractora then Clear and Brilliant? Guys, it's right here. That's what we're doing right now. We just did our Fractora. Now Nisha, the PA, is going to do Clear and Brilliant.
All right, so now we're going to switch over to our Clear and Brilliant. This is going to be a little bit warm, so we have this fan going. I'm going to kick it up a notch, put it on high. This is going to help to keep them cooler. And we're going to start here on the forehead. Now, this is a super comfortable treatment. Really, all you feel is a little bit of warmth. And that's why we have the fan to cool you down. Now, I was mentioning earlier, one of the things I really love about the Clear and Brilliant, besides the fact that it's minimal downtime, besides the fact that you can use it on all skin tone, the biggest thing that I love is that I can treat two different things at one time with two different hand pieces with very little effort. So right now I am using the Clear and Brilliant original hand piece, and this is more so to address texture concerns. Remember, even though we're doing Fractora, which is like my holy grail for treating textural concerns, we like to combine treatments to give you maximum benefits, right? So right now I'm combining it with Clear and Brilliant to address his textural concerns, and then I'm going to switch over to my other Clear and Brilliant handpiece that will more so address pigmentation.
All right, I got a couple questions here on cost. Guys, that requires different amount of treatments, different numbers, different areas. So guys, send us a DM, full name, email, and phone number. We can have our treatment coordinators reach out to you. We can have Nisha, the PA, or Dr. Emer, depending on your consultation needs. And we'll get a custom treatment plan developed exactly for your goals. And if you need skincare and can't come get treatments for us, we'll ship your skincare worldwide.
Remember, guys, you can come in office for an in-office consultation. We can do a virtual consultation, whether you're in the area or not. Doesn't really matter. We want to make it super convenient for you to be able to get treatment and really discuss kind of your treatment plan to help you achieve your goals. So you can see, this is a non-ablative laser, which means the downtime for this is going to be minimal.
You guys, for those of you that want to see an ablative laser, we might be going live this evening with the CO2, which is going to be our ablative laser. That is the one that goes deep. That is the one that is messy that you guys like to see.
We have some, everyone loves the messiness. But remember, I like to make sure that our clients are aware that there's a wide variety of lasers that we use here in the office, and that not to be afraid to do something and get advice on what you need. The most important thing is to get started, right? Whether that's just with good skincare, but also combining that with lasers as well.
So do we have any tightening lasers? Anything to tighten people?
We do have tightening lasers. We just mentioned that we have the Morpheus 8, which is the microneedling radio frequency. We also have Thermogen All Therapy, which is used to tighten the skin. I actually have a combination treatment that I really enjoy doing. It's a combination of using All Therapy and then combining that with Morpheus 8. Remember, All Therapy is ultrasound energy that's used to tighten the skin. You can do that once a year. And then Morpheus 8 is used to tighten the skin as well. And we recommend initially 3 sessions, about 4 to 6 weeks apart. Oh, way to the left. Perfect. You're doing awesome.
So for someone like him, how many sessions to go to reach his goal?
Well, we're going to make sure we show you guys the before and after so far, his progression photos. He already has a ton of improvement. Remember, the endpoint is going to be dependent on my client and what his endpoint is, right? We've already improved the skin drastically, but remember, taking care of your skin is an ongoing process. So you don't want to just get to the point where you want to be and then just stop. You want to be able to maintain those results. But what do you think? We'll ask them. What do you think? Are you happy with your results so far?
I'm so happy. Like, honestly, my skin's greatly improved, and when I look in the mirror, like, I see myself like smiling a whole lot more.
So that, to me, that is success, right? That's what we want. We want you to get to a point where when you look at your skin, you are happy with what you see. Now remember, we're continuing to do treatments. Even though he's extremely happy, we're going to continue to do treatments because we just want to maintain his results. We want him to continue to be happy with what he sees, and that's going to make us happy as well.
Nisha, what's better for texture and pores, Clear and Brilliant or our Halo?
So that's going to depend now.
They're 2 different animals.
It's like comparing apples and oranges. So when we talk about texture, remember, what laser we do is dependent on the downtime, what we are addressing, specifically how severe your acne scarring is or texture is, right? So we can do either one. Clear and Brilliant is great in this case because, my client's always on the go, so just doesn't have the time to sit down to heal from something like a Halo. It's just a few more days, but we cater to what your timing is and how much time you have to do either treatment. So Clear and Brilliant and Halo, 2 different things. Halo is an ablative laser, so the downtime is a little bit longer. Either way, whatever one you choose, you'll get good results. I still recommend you combine it with Fractora, okay? Because those lasers are great for overall tone, texture, fine lines, and wrinkles. And when you combine it with Fractora, those results just improve drastically more. Maybe tuck it up a little.
Guys, we love to do our Halo Pro Fractional in combination with our Morpheus and other microneedling for our acne scar. We have a lot of great results with that.
Really quick.
Do you recommend Morpheus 8 for acne scars also?
Remember, Morpheus 8 is more so for tightening. You might get a little bit of texturing out of it, but it's more so for tightening the area. Now let me show you how quick and easy it is to switch over and use one handpiece to the other handpiece, right? So I just got done using my original handpiece. This is for the texture, this is for fine lines and wrinkles, and now I'm going to switch over and use the one for pigmentation. I'm just going to holster that one. I'm going to grab my other one. And just like that, I'm good to go. Now I'm going to do a few more passes with this one. And this is a Clear and Brilliant Permea handpiece for pigmentation. And now we're going to go ahead and address that with this handpiece.
Can you do a live with Halo from A to Z, guys? We can't show you everything we do here. Some of that stuff is secrets of Dr. Emer. So we will show you some. We can't show you everything. If you are a doctor and you do want some training with Dr. Emer, make sure you email pj@jasonemermd.com. We can try to get you in for some learning.
Alright guys, so we are finishing up the Clear and Brilliant. Remember, we've done our Fractora. We're done our Clear and Brilliant with the original handpiece. We're now moving over to our Clear and Brilliant with the Promea handpiece, addressing his pigmentation. Last but not least, we're going to do our PRP. Remember that PRP is a concentration of your own growth factor. So the way that we get the PRP is that we do a little quick and simple blood draw. We spin down that blood and take out all the good growth factors. We call it the liquid gold, the PRP part. And then we can use that topically on the surface of the skin to help promote his healing process. Now, PRP is great. I'll show you a little bit because I'm going to apply it in just a second. This is the PRP. This is the liquid gold. This is the good stuff. We're going to apply this at the very end. This is going to promote healing, whether it's ablative, non-ablative. We can do a lot more other things with this product. We can inject it into the scalp to help with hair growth. We can inject it really anywhere. We do pee shots with it as well, which is really awesome.
All right, guys. Thank you very much for joining us right now.
All right, guys. Until next time, it's Nisha the PA at Dr. Emer's office. I'll see you guys then. Bye, guys.